Welcome to What is Snoring? That funny rumble in the night. Have you ever wondered why some people sound like a freight train when they sleep? Or perhaps you've been told you're the culprit behind those nocturnal rumblings. Snoring is a phenomenon as common as dreaming, yet often misunderstood. It can be a source of amusement, frustration, or even concern. In this video, we'll demystify snoring, exploring everything from its basic mechanics to its potential health implications and, most importantly, what you can do about it. So let's dive into the fascinating world of sleep sounds. At its core, snoring is the sound produced when air flows past relaxed tissues in your throat, causing them to vibrate. It's a very common occurrence, affecting millions of people worldwide. To understand snoring, imagine your airway as a flexible tube. During sleep, muscles in your throat and tongue relax. For some, this relaxation can narrow the airway. When you breathe in and out, the air rushing through this constricted space causes the surrounding soft tissues, like your soft palate, uvula, tonsils, and tongue, to vibrate. This vibration produces the characteristic sounds we know as snoring. The degree of obstruction dictates the loudness and type of snore. From a gentle purr to a roaring rumble, it's all about how much air squeezes through how little space. Common causes of obstruction can include factors like the anatomy of your mouth and sinuses, alcohol consumption, allergies, and even the position you sleep in. Snoring isn't exclusive to any single group, but certain factors increase your likelihood of becoming a nocturnal noisemaker. Let's look at who snores and why. Age is a significant factor. As we get older, our throat muscles tend to lose tone, making them more prone to collapse. Weight also plays a crucial role. Excess fatty tissue around the neck can compress the airway. Lifestyle choices like alcohol consumption and smoking can relax throat muscles and inflame airways, respectively. Men are also more likely to snore than women, though women's risk increases after menopause. Even your sleeping position, especially sleeping on your back, can contribute to snoring by allowing gravity to pull tissues down. Not all snores are created equal. Understanding the different types of snoring can help determine if it's just an annoyance or a sign of something more serious. Primary snoring, often called simple snoring, is the kind that doesn't significantly disrupt your sleep or health. It might be loud, but it's consistent and usually doesn't involve pauses in breathing. Problematic snoring, on the other hand, is irregular, often characterized by gasps, snorts, or pauses in breathing, and is a strong indicator of an underlying issue like sleep apnea. The sounds themselves can offer clues. A consistent rhythmic rumble often points to primary snoring. However, if you hear gasping, choking, or snorting sounds, or if the snoring stops abruptly for several seconds, these are red flags that warrant medical attention. While often dismissed as a mere nuisance, snoring can sometimes be a warning sign of serious health conditions. It's crucial to understand when snoring moves from being just that funny rumble to a genuine health concern. The most significant health implication of snoring is its strong link to sleep apnea. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts during sleep. These pauses, which can last from a few seconds to minutes, reduce oxygen levels in the blood and put stress on the cardiovascular system. Even without full-blown sleep apnea, chronic snoring can lead to other health problems. These include daytime fatigue, irritability, difficulty concentrating, and an increased risk of high blood pressure, heart disease, stroke, and diabetes. The constant disruption to sleep, even if not fully waking the snorer, prevents the body from achieving restorative sleep stages, leading to these cascading health effects. The good news is that for most types of snoring, there are effective solutions and remedies available. From simple lifestyle adjustments to medical interventions, quiet nights are within reach. Simple lifestyle changes can make a big difference. Maintaining a healthy weight, avoiding alcohol and sedatives before bed, and quitting smoking can significantly reduce snoring. Sleeping on your side rather than your back can also help keep your airway open. Home remedies like nasal strips, chin straps, and elevated pillows aim to physically open the airway or support jaw alignment. For more persistent cases, medical interventions include oral appliances custom-fitted by dentists to keep the jaw forward, CPAP, continuous positive airway pressure, machines for sleep apnea, and in some severe cases, surgical procedures to remove or stiffen tissues in the throat. It's essential to consult a doctor if your snoring is very loud and disruptive, if you experience pauses in breathing during sleep, daytime sleepiness, morning headaches, or high blood pressure. These could be signs of sleep apnea, which requires professional diagnosis and treatment. We've journeyed through the world of snoring, from its basic mechanics to its potential health implications and the many ways to manage it. Remember, snoring isn't just a quirky sound. It's a sign that your airway is partially obstructed during sleep, and for some, it can be a gateway to more serious health issues like sleep apnea. The key takeaways are: understand why you snore, recognize when it becomes a health concern, and explore the various solutions available. By addressing snoring, you're not just ensuring quieter nights for yourself and your loved ones. You're actively promoting better overall health and well-being. Prioritize your sleep and embrace the calm and quiet rest you deserve. Sweet dreams.